So I'd like to introduce our first speaker, Saoirse Roberts. She joined the AKU Society team in 2014 as the Online Communications Officer. As I mentioned before, the AKU Society is a patient group supporting those affected by the rare genetic disease alkaptonuria, otherwise known as black bone disease. Saoirse's role focuses on communication with patients and with other organisations. She's in charge of the website, social media, PR, and media relations. She particularly enjoys writing the weekly blog and is a big advocate for the professionals' benefit of social media. And Saoirse recently spoke at the 7th Annual Social Media in the Pharmaceutical Industry Conference on why pharma should be engaging with patients through social media channels. Welcome, Saoirse.
So I'd like to start my talk today by asking you all a question. So how many people in the room here have ever used any form of social media? Hands up. So that's quite a lot of you. That's kind of what I expected. So how many of you are working for organisations or patient groups that use social media professionally in their organisation? Okay, so quite a lot again. That's really good. So what I'm going to talk to you about today is why this is really important and why we do need to be using social media through professional means, not just personally. So, the way I'm going to run through my talk today, I'm going to start by talking about patients using social media and how they're actually using it, because I think that's really important for us to understand how patients are actually using social media before delving into using it yourselves as a patient group. Then I'm going to talk to you a bit about our Reaching Communities project at the AKU Society. And this is a project that we're doing to mainly using online communications to try and reach out to lots of people, not just patients. And then I'm going to speak to you about specific examples of how we are learning to engage and how we could think that this knowledge can be transferred to you guys, how you can learn also from the experiences we've had. So I'm going to start by talking about patients using social media. So as Online Communications Officer at the AKU Society, I connect with patients quite frequently online. As you've heard, the AKU Society is a patient group for the rare disease alkaptonuria. It's very, very rare, only around 1.5 million people have it. So social media for us is incredibly important. Now, 42% of respondents in a recent survey by the IMS Institute said that they use social media to find health information online. Now that's quite a large percentage, and I believe that that percentage is also growing. And that's because the same report said that 89% of 18 to 29-year-olds now use social media, compared to just 43% in the 65 plus bracket. So as older people are usually the primary users of healthcare, then you would say that as this group grows older, people are only going to be using online and social media to find information more. It's not going to go down, it's going to go up. And what I found interesting was another study said that 90% of the people who have found health information online said they would trust that information. They would trust it and they would use it to inform their healthcare decisions. So I think that's quite interesting to think about as we go through the presentation. So it's important to realise that those stats I just showed you are for the general healthcare population. They're not specifically for rare diseases. So I think that rare disease statistics would be even higher because traditional healthcare information routes might fail rare disease patients more often than they do other patients. So I think that rare disease patients need these social media networks even more. And I'll give you an example. So this is Jess Barnes. She has a son who is 4 years old. He has alkaptonuria, or black bone disease. And I recently interviewed her to see how she had found this diagnosis and how she had actually got her son diagnosed. So she first noticed something was wrong with Daniel when she saw that his nappies were staining dark red and black. And this is actually a symptom of AKU, and she didn't know this. So she brought her son to the doctors, they did various tests, all of them came back negative. According to them, there was nothing wrong with him. So they carried on life as normal and started potty training him. They noticed the same thing was happening again in the potty. The urine would turn black and red colour, and if left for even just an hour or so. And Jess was worried. So, having been failed by doctors, as it were, she went online. And her quote says here, "After a bit of research on the internet, I came across black bone disease, and we requested he be tested." So, as a rare disease patient, or as a rare disease parent, she went online to find that information, because she had no other way to turn. So for rare diseases, having an online presence as a patient group and getting the correct information out there so that patients can find accurate information that they can trust, that's really important. Now, Facebook is actually the 4th most popular source of health information in the UK. And I think that's quite impressive if you think about all the other traditional routes you can go down to find healthcare information. So why particularly Facebook? So I was thinking a little bit about this, and a few months ago, a patient or a parent of a patient got in touch with me, and they got in touch with me over Facebook through our AKU Society Facebook page. She Facebook messaged and said that her daughter had just been diagnosed with alpha-nuria. Her daughter was 6 years old, and so obviously she's very a concerned mother and wanted to find out a bit more. She had already visited our website, and she'd already found a lot of information, so she was well informed, she knew what she was talking about. Now on our website we have lots of ways you can contact us. We have lists of our emails, and we have a contact form, and we even have a page with doctors' emails so that you can contact expert doctors. But instead of going down any of these routes, she chose to find our Facebook page and to message me through that. So I think that we can learn from that and just think about why people choose Facebook. It's actually for the support. Facebook is less kind of clinical and clean than the website. It's more friendly and interactive. We post updates every single day, so patients and people who are following us on Facebook will respond. They'll interact with us through Facebook, so it's a lively and vibrant community. And I think that community really shows and makes patients feel comfortable about asking questions through that network. So I think it's really good to think about social media as a real tool to encourage patients to interact and talk to one another and find out information. So with all that in mind about how patients are using social media, I wanted to talk to you about our project and how we are using it to try and reach those patients. So the AKU Society was set up over 12 years ago now, and it was set up by these gentlemen here. So on the far side you can see Robert Gregory. He unfortunately passed away last year, but during his time he made an incredible contribution to the AKU Society. He set it up and he fought for patient rights for those patients. Dr. Ranjanath in the middle, he is our expert on alpha-nuria, and he worked with Robert to set up the AKU Society. And Nick at the end, a lot of you will know Nick Thoreau as the founder of Findacure. Before he founded Findacure, he was, well, he still is, the CEO and chairman of the AKU Society. And he started to work with the AKU Society when he found out his 2 sons had alpha-nuria. So at the time, over 12 years ago, they only knew of 4 patients. They knew of Robert and his sister and Nick's 2 boys, and that was it. Now we know of around 1,000 patients across the globe, and I think that is a huge difference. We've come a long way in a short amount of time. So with such a rare disease, how did we grow our community so much? Well, I think the big thing for us was communication and information, being able to disseminate communication and information properly. And so if you disseminate your communication and information properly, you're raising awareness. If you manage to raise awareness, you can start to identify patients because they'll find you online and they'll start to contact you. If you find patients, then you can then support them, and that's really crucial as a patient group. You need to be able to support your patients. If you're supporting patients, you're then communicating and giving more information, and again the cycle goes round, so you create more awareness and then you identify more patients, and on and on and on. So what's that got to do with social media? Well, I would say that social media is a huge and important form of communication. It's a tool for communication. And if patients are using social media, which we've seen they are, then why not use it as well to find those patients and communicate with them, if that was their preferred tool. Social media is an excellent tool for this type of communication. You can raise awareness through campaigns. You can identify patients by being out there and they can find you a lot easier. And you can support patients by disseminating your information regularly and quickly. So this is why in 2012 we decided to apply for a grant from the Big Lottery Fund for Reaching Communities project. So this grant we decided to focus on online communications, but we also link it in with some more traditional media, as we know that you can't just do one, you've got to do a bit of everything. We have three main goals, I would say. So the first is to reduce isolation of our patients, so build on the current social media channels that we already use, and also to create a new community where patients can speak to each other in a more secure forum that's just for people who have their disease. So we're kind of going down both routes, both the traditional media that people already have and newer types of media. And we hope this support would start to help people feel less isolated and improve mental health on a whole. We then decided we wanted also in this project to improve education and awareness. Patients are searching for information online and we wanted to make sure that information was provided by us and that it was accurate and the right information that they should be getting. So we have been using social media to put out that information, campaign about it, and not just educate patients and doctors, but also pharma and the public. So educating everyone and raising awareness generally. We also wanted to improve the standard of care that patients get, and I think this very much links in with the previous point, because you might think it's quite difficult to improve the standard of care through social media. But actually, if you aim to educate doctors and campaign for rare diseases to be noticed in the political sphere and taken seriously politically, then that awareness will be built and people will take those diseases more seriously at the lowest level. So diagnosis, patients will be treated better and will get better diagnosis if doctors are more aware of diseases and rare diseases as a whole. So have we done this? And if so, how have we done this? So we're halfway through our 5-year project now, and I wanted to give you some updates and a few tips on how we're doing and how this might help you guys in your disease. So I want to speak about Facebook first. So we had a Facebook page anyway, and we decided to build on it. So we now post something every day, and we feel like Facebook's quite a patient-friendly and a patient-centered forum. It's very much for sharing stories of the work you're up to, and also maybe some rare disease news, stuff that's going to interest your patients. We've got over 400 followers now, which for a rare disease Facebook page, we think is quite good. And they are all mainly patients and carers who follow us on there. And we have had a lot of people making first contact with us through Facebook Messenger, as we've said. So Facebook's a really great place to try and get patients to find you as well. We also have Twitter, and we have over 800 followers on Twitter. And we see Twitter as a bit more of a professional network. It is also used by patients, but it's for patients and professionals and other organisations. It's for building relationships in the entire rare disease community. So as a patient group, you can interact with the individual activists, and you can interact with rare disease groups, such as Genetic Alliance UK, Rare Disease UK, and you can also see what other rare disease groups are up to, and you can learn from them, from their activities and how they're promoting themselves. And as rare diseases, I think we all need to interact quite a lot. We all need to stick together to get our message across, because we're all quite small individually. And that's what Findacure is about, but I think it's also what Twitter's about. So you may have heard of Oliver Rayner. He is a cystic fibrosis patient, and he also works with the Cystic Fibrosis Trust, and I believe he's spoken at one of these Findacure events before. He's a big fan of Twitter. When I first started my job, I had a call with him because he's a big Twitter advocate, and he said he used to find Twitter a bit silly, didn't really understand why people went on it, But then he realised it's actually quite a powerful platform, and he's since been involved in many online campaigns on Twitter, one of which resulted in the NHS funding a cystic fibrosis drug, which they weren't going to fund initially until that campaign came online and really powered that message through. So it's also important because cystic fibrosis patients can't meet together in a room because they may get cross-contamination, they may not be able, it might make them quite ill. So it's actually quite important for them to meet virtually and to campaign online. And I think that's the same for other rare diseases. Other patients may not be able to get out of the house as often as they'd like, and it's really important to have that network in your home quite easily at the click of a button to be able to feel involved in the community, whether you're feeling ill or whether you're feeling able. So I think the real key is to create good content for these sites. You may be thinking that you can't really post that much, you don't know what you put. For example, we post on Twitter 3 to 5 times a day, and we make sure we keep doing that. You might think, well, I don't have enough to post about. Well, there is actually quite a lot if you search for it. So, for example, if you want to post about other rare disease news, you can go on Google Alerts, you can search for rare disease news stories, and you can find lots of general rare disease news stories and support other rare disease groups. It doesn't always have to be about yourself. Of course, you can promote yourself, and that's a really good thing to do, especially if you've got a blog or anything like that. You can also search on Twitter for the rare disease hashtag, so hashtag rare disease, and find, or any other hashtag genetic disease, things like that, or just search keywords, and that will bring up a load of stories that other people have posted, and that can give you some inspiration for what to post. There's also campaigns, so this infographic here was something that Bloom Worldwide, which is a social media company, produced for us during our last fundraising campaign, which was a big crowdfunding campaign. And because that's quite an online-based campaign, we put a lot of work into promoting it through Twitter and Facebook. And producing images and graphics is a really important part of Twitter, I think. It doesn't have to be as complicated as this was produced for us. It can be as simple as a photo of a patient when you're posting about a patient's story, just to make it a bit more interactive and visual. So you can also post questions and be interactive. Ask your patients what they want to see. You can not be afraid of talking to people online and engaging and getting a response. So the key is variation, really, keeping it varied and not being afraid just to go for it and post stuff that you find interesting as a group. So we also spoke about setting up our own online community, so separate from your Facebook and your Twitter. Now, Patients Like Me is a really great forum where people can go online, they can sign up, and they can become part of a rare disease group and speak in forums online. So we set up a specific forum for our bacteriuria where patients can go on, and we have over 140 users now. We have about 40 people logging in per month, and so it's quite regularly used for such a small population. On there we have forums where people can chat and ask questions of each other. They can also record their health records, so they can record mental health and how they're feeling on a day-to-day basis. And they can also join in events that we do. So we often, to try and get more interaction on the site, will hold an expert forum event every now and then. So this involves bringing on some doctors or some experts in a certain field, such as researchers into your disease, online, and saying, these guys are going to be online for a week. If you, as patients, have any questions for them about research or about mental health, then come online and ask questions about that field. So our most recent one was on mental health, and we not only got experts, but we got some people from other forums who are quite big mental health activists, and they came in and helped our patients start talking about mental health, because there's quite a lot of stigma around it, so we wanted to open up that discussion. So they're quite good events to do on closed forums where it's quite secure. We also have a Rare Connect page. So Rare Connect is actually free to set up. So this is a really good one if you're quite a small patient group with a small budget. You can get in contact with your Audis and Nord, and they will work with you to create a new community specifically for your rare disease. So on that forum, patients are able to share their personal stories, and they're able to speak in forums, just like in Patients Like Me. The benefit of this site is actually that there's a human translation aspect to it. So patients from all across the world can speak to each other and not be kind of stopped by language barriers. So patients can post in their own language, and there is a Google Translate button But if that often doesn't work and doesn't come across with good translations, so if that's not really functional, you can click on the Human Translate button, and by the next day there will be a free human translation there for you to make sure that the message has got across and you can have a proper conversation with other patients, no matter where they are in the world. So that's a really good advantage of that site. And we found that's worked quite well for us. So the other thing that we've done in this project is that we've worked with the Royal College of General Practitioners and funded a e-learning module for GPs. So we wanted to find a way to try and improve healthcare and improve diagnosis at an early stage in the rare disease alkalinuria. And we found that that's quite a difficult thing to do simply through using online tools such as social media. So we decided to work with RCDP to create this online e-learning module that's actually accredited. So doctors can use it and it will be part of their continuing development. They'll actually get points for doing this module. So it's a half-an-hour module. It has questions at the start, learning throughout, a video in the middle, and then questions at the end to test whether they've done it well. We launched this just in February on Rare Disease Day, and we have actually had 110 unique users use it so far. Those who have actually completed it have been about 17 people, because obviously it takes about half an hour to do, so you have to be quite committed to actually go and sit down and do it. But we're hoping we can grow that, and through promoting it through social media, which has been quite a good way to promote it through the RCDP have been promoting it for us as well. So we're hoping that will continue to go up and more people use it. We've actually had some great feedback. So one of the comments on our feedback form said, this rare disease I knew little about. It's so very important to learn about it. It was a very well presented module with an excellent video about real cases. I will think of rare diseases when unusual symptoms come up in the future. So not only has this person done the module and thought it was a good module, they've also thought, well, that's opened their minds to other rare diseases as well. So I think that comes back to supporting each other as a community. I think as soon as one person starts to do something, it opens up people's minds to other rare diseases as well. So to conclude, I'd just like to say that patients are using social media, and so you should be using it too. And I'd also like to say that doctors are using it. So that it's really a good place to connect with all types of people, other rare disease organisations, and you can support other people through that as well, individual campaigners. So I would say get yourself online and ensure patients find your information first, because that 90% of people who trust that information immediately as soon as they find it online, you want them to be finding your information, your accurate information. And then I'd say, once you find those patients, support them through producing good content and promoting your campaigns. And then use it as a tool, because it is a communications tool. So campaign through it, and even fundraise through it, and raise awareness. And overall, you can then connect your patients through social media and invite them to then meet in person. So another project we do, for example, is having patient workshops, more physical patient workshops, where people actually meet. We have activity days. So it's not just about online, it's about using your online communities to bring those people together in their life and plan other events. So yeah, that's what I'd like to say today. So if you have any questions, please do ask.